Everyone, I'm Dr. Keenan, and today we're going to talk about a very powerful nutrient that impacts your health from your brain to metabolism to inflammation, and this is omega-3s. And the answer is yes, you need them in your diet. So what are omega-3s? So omega-3s are essential fatty acids. So they are essentially needed in the body. We cannot get them, we cannot live without them. They don't get generated with inside. So we have to get them from an outside source. So the two key types that we talk about are EPA and DHA. And these sources of omega-3s typically come from fishy foods. But there's also a type of omega-3 called ALA, which comes from plant-based food. So things like flax, chia seed. But this type is not as easily absorbed in the body, and it's not readily converted into omega-3s like the fish-based foods. So what do these do? So omega-3s play a role in cell membranes, in our brain function, and to regulate inflammation in our body. So why are we so out of balance? In our modern society, why do you hear so much about omega-3s and their importance? It's because of the nature of our diet. We eat way too much processed foods, and these foods are filled with omega-6 oils. So this is going to make our balance of 3 and 6 to be out of proportion. So typically, historically, if we look back, the ratio should be 1-to-1 or 4-to-1 of the 3 to 6. But now I see, especially with my patients, as I'm testing, many people's level, including my own, was 20-to-1. I've seen patients as high as 35-to-1. It's very rare that I see anyone that is at anything close to normal without taking some form of supplementation. So why are they so important? Why are they truly one of the essential vitamins and supplements that I really talk about with my patients? So number one is our heart health. We know omega-3s can improve triglycerides. And often people don't pay attention to your triglycerides when you're looking at your blood work. Many times doctors will only speak about your total cholesterol, but really triglycerides make a huge difference, and omega-3s can help in lowering that number down. They can also help with your blood pressure, and also interesting studies just released 2 years ago showed that omega-3s can reduce the plaque within your blood vessels. So it was a fascinating article. What they did is they looked at people that had previous heart attack. And so these patients were put on a statin therapy, like you've heard about, Lipitor, Crestor, and they followed people along. And so with one group, they all had heart attacks, they were all on a cholesterol pill. They measured the plaque inside their coronary arteries. The one thing that they did is they gave one group fish oil and they didn't give it to the other. So the group that were on the statin, that were just doing their regular diet, they continued to build up plaque within their arteries. So even though they were on that medication, they were still going to get more hardening of the arteries. But those that they gave fish oil to, not only did they not build up the plaque, they actually reversed the plaque. So we really need to begin to think about this when we're thinking about cardiac protection. The other thing, it's so important, omega-3s, for brain health. So it improves our cognition, our focus, and our mood. There are studies that are out that support the use of omega-3s, and actually they do even head-to-head studies with omega-3s versus some SSRI drugs like Prozac, and we can actually get very similar results. Or even better, if you're on something like this, adding in an omega-3 can further enhance the antidepressant or the anti-anxiety effect. We also see a reduced incidence of Alzheimer's dementia disease for those people that are taking high-dose omega-3s. And one of the things that I'm dealing with every day in my practice is metabolism. Everybody wants to lose weight. And of course, there's lots of drugs out there. And I see many patients, they're on things like Ozempic or Wegovy for weight loss. But sometimes they come to stalls and then they see me and I find out what's really going on. Well, one of the things that we know is that without sufficient omega-3 to 6, you are going to have a difficulty with fat loss, because omega-3s work to improve insulin sensitivity in our body. So this is why it's important, not only if you've been gaining weight, if you're obese, if you have fatty liver disease, but for sure if you have diabetes and pre-diabetes, because you want to help with insulin sensitivity. It also has an impact to play in our brown fat. Now, a lot of us aren't familiar with brown fat, but brown fat is kind of deep within us, kind of behind our neck, behind our chest bone, but it's metabolically active fat. So what does this mean? The more brown fat you have, the more that you burn calories just at rest. And we know omega-3s are going to raise that amount of brown fat that we have in our body. So the way to think of omega-3s is like they're the conductors in your metabolic orchestra. So they can tune your hormones, they tune insulin, they enhance your fat burning, and they also can calm the fires of inflammation. And this is why having omega-3s in your body is going to help you burn more calories at rest just by doing nothing, by taking maybe some supplements or eating some food. So then let's think, what else is it doing? So another thing people talk about is inflammation. So what is inflammation? Some people feel it as puffiness in their joints. Other people feel it as achiness in their bones. Sometimes I see inflammation in the blood in the form of a blood test called CRP. But what we know about omega-3s is that they are natural anti-inflammatories. So they help with arthritis. They can help with these autoimmune conditions, and I definitely see that they have an impact in lowering the CRP, or the inflammation marker in the blood. We also know that, of course, inflammation begins in the gut, and omega-3 is very beneficial for also helping to nourish those gut bacteria. So longevity, what else do we worry about? We want to live longer. We want to be healthier. And the studies from the Framingham Heart Study, which is the one that really talked a lot about heart disease and cholesterol, back in 2018, when they looked at that data and they reanalyzed it, those individuals that had higher ratios of omega-3 to 6 had lower all-cause mortality. So what does that mean? They died more of things like heart disease and cancer by having a better omega-3 and omega-6 ratio. So how do we get omega-3? So where do we get our food sources? So primarily they're found in fat. So we know that fatty fish, So we typically talk about the smash fish, and these are salmon, mackerel, anchovies, sardines, and herring. So I usually say to my patients, how many times a week are you eating salmon, sardines, or mackerel? Because most people don't eat much herring or anchovies. But the Heart Association tells us that we should be eating these fatty fish at least 3 times a week, because these are the most potent sources of EPA and DHEA that you really need in your body. Now, you can also get them from vegetarian sources, things like flaxseed, chia seeds, walnuts, which are something that I still eat every day. But the vegetarian sources come in the form of what's called ALA. And this has to be converted in the body, and it's not converted as efficiently as if you take it from a fish-based source. Now, I know there's a lot of people that don't eat fish, and also there's reasons maybe that you don't want to eat fish, but you need to get this in your body. So if you don't get it from food, then really, and I recommend this to almost all of my patients, is it's one of the things that I really feel that we need to supplement with. When I had my level done, so I try to eat sardines, a can of sardines twice a week, and then maybe I'll have a can of salmon or a can of tuna. And my ratio was 20-1. So I have started supplementing. I have been supplementing for years. But after I got my level tested, then I did supplement every single day. So the product I'm taking now is called Zenzino Balance Oil. One of the reasons that I started taking this product, it's a very high source of omega-3 to 6. It is a very clean product. The one thing that when we think about supplementing with anything that's fish oil based, you want to consider where it's coming from, the company that you're getting it from, because a lot of these fish can also contain higher levels of mercury and toxins because sadly they're getting them from our seas every day. So the company Zenzino is based in Norway. I ship the oil in and this is what I take. And I've had my family members tested. The levels have ranged from 15-1 to 35-1. So I've got everybody almost, the kids are having a hard time still, but I have them on fish oil. I take this as a liquid. I take it every morning. And most of my family that are taking it now, they got used to it. It's not a fishy taste. It's actually kind of lemon flavored, but it is so good for us. And it's essential that we really get this. And when do you take fish oils? If you are taking them at home, you do want to make sure that you take it with food, because it's a fatty oil that we're having, and it's going to be better absorbed when you're having it with a meal. So you might have heard me talking about these numbers, or that I had testing. And you might be saying, well, can I just get this done at my doctor's office? Well, sadly, this is not a standard test that we check for in our hospital-based blood work. So I was so happy last year when I was able, I heard about the company when I was in England, when I was doing a conference in lifestyle medicine, and then I was able to bring the testing kits here. So here in Canada, or in Miramichi, we're able to test at the Miramichi Naturopath Clinic, but you can also access the test online. And if you want to send me a like, or if you're interested in the test, just put that down below and I'll send you the link where you can get the test kits. So we want to have a balance of 3 to 1. Okay, like I said, I was 20 to 1. And now my ratio is back in balance again by taking this product that I know is going to be most effective. So if you are out of balance, what do you need to do? Of course, you need to prioritize getting these fish that I spoke about. But one of the key things is beginning to avoid eating seed oils. So many people use canola oil still with their cooking, their baking, whatever they may have. But canola oil is a seed oil, right? It comes from the canola grain, and it's really filled with omega-6. So you really want to think about the oils that you're cooking with. I use an extra virgin olive oil. I use coconut oil. I use avocado oil in my cooking. So considering what you're eating, and of course the processed foods, we know that we shouldn't be having deep fried foods. This can all be part of, a treat once in a while. But if this is really part of your regular diet, then most likely your omega-3 to 6 is going to be really out of balance. And even more than that, you're getting a lot of other toxins from that deep fried oil on a regular basis. So think about just cutting down on processed food in general, eating more of those salmon, sardines, or mackerel, but most likely you're going to need to supplement. Okay? So as I get ready to wrap up for today, I want to know, are you taking omega-3 oil? Okay? If you're not taking it, is there a reason why you don't take it? Because really, of all the essential supplements that we need, omega-3 oils, almost everybody, vitamin D3, vitamin K2. I think for my patients, these are non-negotiables, that everyone really needs to be taking this because they have such significant impacts on your health. So if you want to know more, or if you want to learn more about the testing or where you can get a good quality oil, please send me a message in the chat, comment test, and I'll send you further details. I hope you all have a wonderful Friday and go out and try to find some fish this weekend. Take care. Bye for now.